Dance to the rhythm of our drums. Sing along to our catchy songs. Afrobeats, we call it. The ways of our forefathers woven into our every being. We can't escape the rhythm we feel in our feet. We are rich in culture and powerful beyond measures. But they say, to whom much is given, much is required. So we hide our pain to cover our shame. But little did we know it was the silence speeding us with a cane. If things are left unspoken, does it mean they fail to exist? If we never named the heat, would we ever feel it? Determined to keep things moving in the face of adversity, we've mastered the no-shaking attitude the young ones call we move culture. From generation to generation, we pass on the African pride, one that can withstand any given tide. We say, black doesn't crack, but what happens when our minds grow tired of suffering in silence, tired of wearing the so-called strong label even when we feel broken? Afromindz, there is beauty in sharing the complexity of this thing we call life. The tears that fall at night doesn't make us weaker. There is bravery in showing your scars. It is part of who you are. To look in the mirror and recognize the person looking back is also who will take you forward. It's time to share the load together.
My name is Mrs. Deborah Olubanke Morakio. I'm a nurse by profession. I did my general nursing, I did my midwifery, and I did mental health back home in Nigeria before I came over to the UK in 2001. And since then, I've been practicing mental health in UK. When we were very young, I don't think I can remember having somebody or know somebody that has a mental health problem. Not that people don't have mental health problem, but it's not really something that people talk about. We normally see people around with mental health problem. We call them, when I was young, we call them mad people. And you see them on the street, they are not being looked after, they are not kept, no care for them from family or government or anything. So we just say that, that person is mad, they're roaming the street, and that's it. Not until when I started my nursing that I really knew what mental health really is.
Okay, I'm Esther Okoro. I work as a resident medical officer. I've got a background in mental health and general medicine, and I'm Nigerian. I worked for some years in Nigeria, and I would start with among the patients I had back home in Nigeria. The field of psychiatry is associated with a lot of stigma that doesn't encourage asking for help, because it's a culture that says, suck it up, man up, you can deal with it on your own. And a lot of people go through different things and they're not able to come up and request for help. Also, in my times of working in the United Kingdom, I have had more white patients and black patients. And I think that largely is because we don't seek for help. We're going through stuff, we're dealing with a couple of things, and then we think we can just manage on our own. And then people keep pushing themselves through till they get to breaking point.
I think we get this notion as Africans, because we always hear this. Oh, depression and mental health doesn't happen in Africa. People are really suffering in Africa. People here in the UK don't, these are not problems, these are challenges. So when you finally find yourself on the other side, you start to think, of course there are people struggling at home. Of course there are people that have real problems, but mine is real as well, because it's my problem.
I think men find it difficult to talk about mental health because of upbringing, contexts, traditions. For example, what happens in this house stays in this house. If we're going to talk about it from a black context or an African household, That's a rule that is embedded within us from a young age. When I was teaching primary school children, the reason why they wouldn't open up about what was happening at home and they would act out in school is because of that one teaching. What happens in this house stays in this house. And that one teaching carries on with us for the rest of our lives.
For a lot of us, it's mental strength that we want people to think we have. So I think I didn't want people to think that I was weak. And I think, unfortunately, when I think of friends and family, I think with family, I felt like they wouldn't understand. I think they would feel like, I didn't want them to feel sorry for me. And I think family very much quickly goes to like, feel sorry, and I didn't want that. I didn't want to feel like a victim in it.
Because of the way I grew up, which is being a firstborn and always having to be there and not showing my emotions so much and not being upset all the time or not crying. That's probably all entwined together and caused me to feel like mental health does not exist.
Factors in regards to a man should not cry. There's a lot of teachings that we receive from a young age and they determine the course of our life. So I think that's just something that's ingrained within us as men. We don't have correct definitions for what manhood looks like. Furthermore, we don't have correct definitions in the sense that a man can cry and it's okay to cry. When I ask my friends who are on the roads, when was the last time you cried? They'll say like 10 years ago, and that shows that we are holding so much pain. And many of us can laugh over our pain with jokes and running jokes on friends and jealousy and envy. But really and truly, all we need is a good cry. So I just think for men, we have a lot of foundational teachings that need to be uprooted.
I felt ashamed to say that I've got depression. I felt that it didn't fit who I am to say I have depression. What kind of a pastor has depression? I don't know, but I had it.
The difference between talking to a counselor and my family, it's more intimate, I would say. So I get those intimate feels from them that they give me, but that's more intimacy as opposed to understanding.
Not everybody knows how to deal with mental health. Not everybody knows how to support somebody. That's a skill to do that. And not everybody has the capacity to do that, and that's okay. But I think with friends, sometimes it's hard to navigate who those people are.
Lack of knowledge, because they don't know much about it. And they think, and because of the stigma as well, they think, when people know that I have mental health problem, or people will shout, people will laugh at me, people will bully me, or people will not talk to me, they will not be my friend, I'm going to be on my own. So they fear, they get scared, the anxiety is really things that is getting more and more in them. So I think I would say the stigma plays a lot, part in that role.
When an actor goes on stage, they have to just put on a particular persona for the time that they're there. So you don't really think about your feelings. You're just thinking of passing the time, getting on with it, and getting back to your little quiet space at the end of the day. So I don't really feel like I had any feelings. I just knew how to have a laugh, because at the end of the day, they are my friends. So I knew how to just get on with life, but I didn't have to share what was going on with those people. It was my problem, my story. I kept that to myself, but I can't say how I felt. I guess I didn't feel. My name is Chedza. I am a secondary English teacher and a musician, born in Zimbabwe and raised in Leeds. I think for me, it goes all the way back to when I was about 8 years old, and I had quite a traumatic experience myself. And when I was 8, somebody that was trusted to look after myself and my brother abused me. And at the time, I didn't know it was wrong. I didn't know what was happening. And it wasn't until sex education in school that I started to understand what happened and why it was wrong. And coming to that understanding was more traumatic than just the experience itself, just understanding what that person was doing to me and how it made me feel, just reflecting on all of that was really, really disturbing, and it really, really brought me down and made me to feel quite perhaps ashamed, even though it wasn't my fault. I remember when I was 18 being very depressed, and at a time where I was surrounded by lots of loving people, everyone was there. I can't say that I was alone physically because I had my family, I had my friends, but I remember just not wanting to be around anyone and wanting to be by myself because nobody could understand the struggle within, really. And I remember everybody had left the house that day, and I came up with all kinds of ideas to cause some kind of harm that would land me in hospital, which would mean they would have to cancel all my birthday plans. So I remember getting a kitchen knife and trying to slit my feet. And my rationale at the time was that if I could slit my feet and I wouldn't be able to put my heels on, which means I wouldn't be able to go out. And I struggled with that and it just didn't work out. So I decided to go to the top of the stairs and throw myself down the stairs. And I remembered this because when I was a lot younger, my uncle fell down the stairs with my little brother, and I remember my mum told me the story that he cradled my brother so much so that my brother wasn't harmed, but my uncle sort of scuffed his elbows. And so in my mind I thought, well, if I could fall down the stairs the way that he did and just knock my head somewhere, and perhaps somebody would open the front door and find me at the bottom of the stairs, then I wouldn't have to go because they'd have to take me to the hospital. And I just remember just trying to fall down the stairs, and every time it just didn't work, and I just kept going. I tried a few times, and on one of the occasions somebody came through the door. I think it was my mum and my brother, and they were asking what was going on, and I just said, oh, I fell down the stairs and sprained my foot. And I remember trying so hard to force a limp to show that I was injured, that I couldn't go out today. The ambulance came and checked my leg, and they said that I was absolutely fine. And I just remember being so angry that I couldn't inflict enough harm, enough pain to cancel all the plans for the day. And for me, that was the point that I realised that I'd probably reached the peak of a decline in my mental health. I just wasn't in a good place. As much as I was surrounded by so many loving and happy people, I know inside that I wasn't, but I was able to put on quite a facade that nobody really picked up on, the fact that she's not okay. So again, it was just the suffering quietly, silently, and just not being able to verbalise that I needed help. So at that point, I didn't know how to get help, even though I knew that there was something wrong.
I'm Emma. I am a mental health researcher, and I am Zambian and English. I think my experience with mental health has been throughout my life. I think it's started from when I was very young, of having feelings of anxiety, of happiness, of sadness. I think all of that is your mental health. I think as I got older though, I think I started to understand maybe more of the impact of mental health. So when I started experiencing things like anxiety and depression, I think that's when I kind of saw how mental health played out in my adult life. When I kind of think about maybe my lowest point in terms of my mental health, it's still sometimes a hard thing to talk about. I think crisis can put you in a very isolating place, so it's sometimes hard to tell people when you're in it. I think for me, it was definitely coming out of uni at the end of third year. I kind of had this time when I'd had loads of my friends around me. I had a really big social community around me. And I kind of went back home and it just felt very overwhelming. I think, unfortunately, something happened like in my family that was quite like traumatic, I guess. And it all felt very, very overwhelming. So I think, and it felt like I had nobody to talk to. It felt like I was the only person going through this. I got really in my head about just feeling as if this would never get better. I think when I think of that crisis, it was more of, this is my life now. This is how I'm going to feel. I'm going to feel every day. I'm going to feel like I don't want to wake up. I'm going to feel every day that I don't want to eat. I'm going to feel every day that I don't want to talk to people, that I'm actively isolating myself. And I think when I think of kind of where it came to a head, when I realised that this is more than just a feeling of sadness, I think it was just a point where I remember I hadn't talked to anybody for like a week, and that was like friends, family, and I think I was a very good person of hiding how I felt from people. So I think from the outside, people were like, oh, she's fine. Like she was still friendly. She's still smiley. She still looks like everything's fine. But inside I was like literally like at tipping point. And I remember going to the park, being sat there, and I was just like, I don't want to be here anymore. I don't see the point of my life being here. I don't see what I'm adding to anybody's life. I don't see what me not being here anymore will change to anybody's life. And I think that was a scary place to have in your head, where you're feeling so low that you're apathetic to your own life. You don't care if you're here or you're not. So I think that's when I kind of realized, I was like, okay, something's happening here. I'm like more than just feeling sad each day.
I can't actually remember a time I cried. If anything, cried in front for anybody in my family to see. So they always saw me as the child who just doesn't cry, who doesn't feel emotion. Like, they know that I'm the eldest and I'm always disciplining and everything, but that was because that's what I was growing up to understand, that I shouldn't express myself that way or else it'll be my fault. So for example, they would say, if your younger sibling behaves a certain way, they would say it's because I behaved like that. So I had to be like, okay, I have to behave a certain way so my siblings can realize this is how they should behave. So hello, my name is Queen. I was born in the UK, but I'm actually from Nigeria. I'm a student and also an artist. What I believe triggered my episodes of depression would be when I first came to uni, and I was alone. I would say that I felt alone, and I felt like a lot of things did not make sense to me. So I didn't really know that it was depression, if that makes sense. And so at that time, I just felt like I was drained of all positivity, if that makes sense. And I felt like I couldn't communicate that to somebody because it was in my head. So then all I kept telling myself is not real, it's not real, it's not real, but it actually is real. I felt like I was trapped somewhere. So with depression, I felt like I was in a space where there's no foundation, no roof, no walls, but it's endless darkness, and it feels like it's taken over you or taken over me. It felt like it was taken over me, and I felt like I couldn't deal with it. I felt like I couldn't say anything. I felt like I could only register it with myself, and I also felt like I was the cause of it, which was really where I felt like I caused my own depression.
My name is Omar Taki. I am currently studying theology and counselling in university. I'm also a theology lecturer and a minister in a church, and I am from Ghana and Lebanon. I grew up in a family where I had everything on a silver platter. I had all the clothes I wanted, all the games I wanted. All my cousins would come to my house and play on pinball machines, and I just had arcade games and everything that a child would want. One day my dad was sleeping downstairs in the living room, and I went to him and I said, Dad, what time did you come home? And he gave me a particular time, and I said, I thought Uncle Salim came over. As soon as he heard that, he went upstairs, beat up my mum, black and blue, like to a pulp. And I remember watching it, screaming out. Later on that evening, there was a family meeting that was held in the living room with my mum's side of the family and my dad's side of the family. And my dad was inside the dining room with me and my younger siblings. And he said to me, Omar, why did you tell me that? And my little sister said, yeah, Omar, why did you say that? Lo and behold, my dad got kicked out and he never came back again. A year later, I was in year 7 and my mum told me that my dad filed for divorce. And I always carried this sense of guilt that my mum and dad broke up because of me, because of that one question, Omar, why did you tell me that? See, the tongue has the power of life and death. And there are certain words that stay with you. It doesn't matter what you say. It doesn't matter the intent behind what you say. They remain with you. And those words remained with me. I didn't have a father figure. So the older boys in my area took me underneath their wing. I looked to them as father figures. And so they would introduce me to girls from a young age, drugs, knives, etc. And long story short, I gained a reputation for myself from a very young age. When the older boys in my secondary school left, I had to hold that reputation by myself. And so there was consistent fights. The people I thought were my friends weren't actually my friends. And so trust issues was a very big issue for me growing up. My dad left. The boys in my secondary school weren't there for me. And so I became a one-man soldier. I started to live in isolation, and the Bible was clear, it's not good for man to be alone. And so in isolation, all I heard was my own opinion, my own thoughts, my own judgments. No one could tell me anything because I lived by myself. There was no accountability. No one could correct me. Long story short, in college, I got stabbed. After being stabbed, there was something in my mind that made me feel like I'd conquered death. Like I just couldn't die. Something broke in my mind, like I wasn't fearful of death. And so I became very radical, I should say, in how I was when I was around people. And so I was stabbed. I didn't go to university for 3 months. I told my tutor. I came into uni sometime in January. I got stabbed in October. I came into uni in January. One of my teachers kicked me out because I hadn't been in class. I ended up flipping tables, cussing, swearing. I ended up getting kicked out of college that one day. And essentially, I think what came to my mind at that point when I left uni was, one, I've been kicked out of any type of education because I've been stabbed. It's not my fault. In a moment of recovery, everything was, it's not my fault. It's not my fault. Why me? Why me? Why me? It was so self-focused. And because I was so self-focused, the Bible says pride comes before a fall. My dad came back from Ghana and I moved to South London with my dad. And then I started to sell drugs for my dad. He wasn't the role model that I had wanted. He wasn't the person that I thought he should have been. And so looking at my dad, I saw the man that I didn't want to become. And then I went to Ghana in December 2013, came back January 2014. I spoke to my dad when I was in Ghana. He didn't tell me that he moved out. But when I came back from Ghana in 2014, January, my dad had moved out of the house. And it just felt like, why are people always hiding things from me? Why are things always happening to me? What have I done to deserve this? I came back to the house at like 2 a.m. in January. Electricity was gone, gas was gone, everything was moved out of the house. My room was left the exact same way, so I just went to sleep. I went to sleep at about 2 p.m, woke up at like 7 p.m. in January. It's pitch black, no electricity. I woke up and I tried to kill myself. At that moment there, I'd had enough. It was like, I'm done. I'm at my wit's end. I'm not taking this no more. And that was my first suicide attempt. Obviously, I didn't kill myself. I'm still here. But that moment began a cycle of severe depression, intense depression. I just couldn't smile. Whenever I'd walk around people, it was like I was I brought a heaviness into the atmosphere. And so, again, I reclined and I went inside and I was just antisocial.
No, I did not find it easy to go and speak to people about what was going on in my head, actually, because I felt they couldn't understand me. I felt like I was alone there. And the funny thing was that I looked at the people that I wanted to go and speak to, but it looked like they were happy. So I felt because they're happy, they can't understand how I'm feeling. But I guess that's part of that mindset issue. When it comes to depression, you feel like it's just you, and that because you're sad, everybody else should be. But really, I just know that it's definitely hard to speak out, and it's hard to realize that you need to go and speak to somebody because you feel like I can do it, I can come out of this. Or I don't want to put a burden. I don't want to be a burden on somebody else. I don't want to dampen their joy. That was a big one. You feel like because everybody knows you as a certain way, for you to now go out and say this is what I'm really going through, in the walls of my house. This is how I really feel inside. You feel like they would look at you a different way. They would treat you differently. That's how I felt. And that's why it took me a long time before I could speak to somebody about it, and to get those ideas out of my head, because I needed help.
I am Sandram Tandabari. I am a chartered counseling psychologist. I am originally from Zimbabwe, and I have lived in the United Kingdom for the past 3 decades. Well, in my field of psychology, I am a clinician, and I work with most age groups. I work with children and families, and I also work with adults and couples. And I specialize mostly in post-traumatic stress disorder, but I look after clients presenting with depression, anxiety, and other mental health conditions. With depression, people present mostly with low mood. They lose interest in engaging with day-to-day activities. Depression can be clinical depression, which means that it is biological. There may be some chemical imbalances that the person has to deal with and address. And also people can have what we call reactive depression, which is depression resulting from life situations where things have happened, where they may need to address some of the difficulties they're having, which are causing them to present with low mood, sleep difficulties, poor concentration. Their appetite may be also affected, and socially they may struggle to engage with social activities or turn up for work.
And the other symptoms like difficulty in sleeping or sleeping excessively, overeating. Sometimes it also comes with suicidal ideation. You're thinking about committing suicide. You're even attempting suicide. And other extremes, people start to get deluded. They have delusions, they have hallucinations, they're seeing things, they're hearing voices, they're getting very agitated. So all these symptoms, when they go on for quite a period of time, there is a duration with which the diagnosis of depression is supposed to be made. So if you have 4 of them going on for an extended period of time, then a diagnosis of depression can be made. As against when you just feel sad for a short period of time because of something that happened and then it goes away. But a lot of times in depression, nothing is making you happy. Things that usually made you happy in the past aren't working anymore. You're trying them and you're still not finding some happiness. So it's more of this dark cloud around you that you're unable to help yourself about, as against sadness, which is an emotion which passes.
It would be nice to say that, straight away I went to seek help. I didn't, and I think a lot of people are like that. I think it was probably for a year or even a year and a half after, I was just surviving. It felt as if, I think when I've talked to friends about it, I said that it felt like I was constantly drowning, and then every time it looked like I was about to give up, I managed to just get enough air at the surface before kind of like drowning again. And it felt like that for like 2 years, I think I'd say, where I was coping, I was just surviving.
I was actually suffering from mental health issues for a long time before I was diagnosed. I was sectioned for 6 months, although I was suffering from depression for years before that. I guess I've had depression since I was about 16, but I wasn't officially sectioned until I was 21. My name's Chantal Clark. I'm a qualified social worker. I'm of mixed origin, British and Jamaican. I came from a background where I was in care for most of my life. I was fostered at the age of 6 years old, and I have early set traumas. The actual pinpoint triggering what got me to crisis point was I didn't have a lot of my own memories of what happened to me in early life. I only had the memories that I was given by either foster carers or my parents or my social workers. I then got my own files, my own care files, what social services had, and there was a lot of medical history, and I suffered early sexual abuse from a very young age. And when I got those, I kept that to myself. I didn't tell my family or friends that I'd received these files. I kept the information to myself. And when I read it, it brought back a lot of things that I'd subconsciously buried, that I wasn't, I didn't have to the surface of my kind of memory. It triggered it all back again. And I felt like I was dealing with it on my own. I felt like throughout the years, I've always had quite a strong persona. I was the oldest of my friend group at the time, and I'm the oldest of my siblings. So I've always feel I've played a parental role. So I didn't feel I had anyone to talk to at the time when I'd got these files. And I think having that such a burden, and it felt massively a burden to carry, because not only did I have the information about what happened to myself, but I had the information about what happened to my younger siblings as well. And the knowledge of that, and knowing that my parents had failed us and what they'd done to us, and the fact that I still had relationships with them, I was in conflict because I still had relationships with my paternal, my birth mum and dad. I still spoke to them. So having the knowledge of what they'd done to us when we were younger, and then still having a relationship with them, that brought a lot of upset, a lot of conflict. I knew I was stressed, and I felt stressed. I remember there was a point where I was, my friends and my boyfriend at the time had gone to work. We never lived together, but we was together all the time. And he'd gone to work, I was left at home, and I'd gone outside, I'd sat in the garden, and I was sat on the step, and I don't remember ever feeling so overwhelmed. I just felt overwhelmed about everything. And I couldn't pinpoint it to one specific thing. It was a mix of emotions, and I burst out crying. And I remember my neighbour, she was called Denise, she used to live next door. And she asked me, she said, she come out and she said, "Why are you crying?" I said, "I don't know." And that was the honest answer, is I didn't know why I was crying. It was just, I felt like I didn't want to be here anymore, and I couldn't pinpoint one specific incident that had happened. I just remember feeling like I couldn't go on, and it was then that I knew I was stressed, but I still continued to do nothing about it. And I got to the point where I was that ill, I became delirious, to the point where I had delusions, I had psychosis. So it got to the point where I didn't recognise my mum, I didn't recognise my dad, I couldn't tell you my name. It was friends of mine that had to take me to hospital because I was becoming delirious to them. A friend of mine had invited me to her place for the weekend. I'd stayed there. She'd gone out to get breakfast in the morning and asked me to come with her. But I insisted on staying in the home and said, I don't want to go. And apparently, and I'm saying apparently because I don't actually have any recognition of this. This is what I'm being told after the incident had happened. So apparently she was knocking on the door again, and I refused to let her in, and I claimed to not know her. She instantly recognised that I wasn't being myself, and she took me to my boyfriend's house. But when I was on the bus, I would take, I think there was a woman that had an umbrella, and I claimed it was mine, and I was going up to her and I was shouting at her and insisting that this umbrella that she had belonged to me. And I'd never met this woman before in my life. She'd never met me. And these were all signs of delirium. And when I got to the hospital, my sister came and she removed me from the hospital because she thought I was acting up. She thought it was an act because the transition in my behaviour was so far-fetched. It was so unlike me, she actually thought I was playing up. She thought I was acting because I couldn't tell you who I was. I wasn't speaking in correct sentences. I wasn't making sense. So I didn't actually recognise how ill I was. And even to this day, hearing how ill I was frightens me because a lot of it I don't remember.
I'm Dr. Chichi O'Bwyer. I'm a consultant psychiatrist. I work in the NHS and in private practice. I'm one of the directors at the Mind and Soul Foundation, which explores Christianity and psychological well-being, and I am both Nigerian and British. We know that for certain mental health conditions, the clock does start ticking once those symptoms arise, and it's important for the sake of the long-term outcome that people seek help sooner rather than later. The best example of that is psychosis. Psychosis is a term that includes paranoid schizophrenia, but isn't limited to that. And there's a concept called duration of untreated psychosis. So that's the length of time before someone actually starts taking medication, usually in the form of treatment. So the longer the duration of untreated psychosis, the worse the long-term prognosis. So it is really important that people feel that they can reach out, that they don't feel that they're stigmatized, that they can access help and start treatment, which happens after a discussion about the treatment options.
I got to the crisis stage where help was taken out of my hands. I didn't have an option but to accept help, and I think that's, looking back, if I could have changed that, I would have sought help long before. If I'd known then what I know now, I would have got the help long before, but I'd put my body through enormous amounts of stress that it couldn't cope with, and I was then taken from my home. I was in my dad's house, and the doctor took me to hospital against my wishes. My rights was taken off me, and I was signed into the hospital as a mental health patient. So I didn't actively seek the help. It was given to me, and it got to a point where I either accepted help or wasn't going home. It's hard to admit that I didn't feel strong enough to get help, and it's not a weakness to get help. It's probably the most empowering thing that you can do, is to seek the help when it's there, instead of trying to burden it all by yourself to get to a point that I did. I knew I was stressed, but I didn't know how to cope with it. And so my coping mechanism was to carry on as if it wasn't there, but it was there, and it was making me seriously ill. In future, I definitely, and now I seek the help from family and friends and from professionals where I can, if I need it.
It's generally believed that it's always in the mind. So you're going through a hard time, you're feeling unhappy, oh, you're not doing something right, or it's just you can help yourself. So it comes from the point where we believe that mental health illness is not really an illness, it's just a state of the mind. So you feel this particular way, so you need to do this and get out of it. There's also a cultural and religious myth that says, oh, it's devils, it's demons. So that's the reason why you're having problems. So people would not seek medical help for things they think is spiritual.
Back in the days, I would say that church play parts in the stigma. What the church believe is that probably the person is being attacked by demon, because even in the Bible that Jesus Christ cast out demon from a child that was demonic. So the church now try to come round and pray for the person. In those days, I could remember they used to lock a mental health patient in a room. That's a church, in Africa, that all mental health patients, they will take them there, their family will take them there, they will lock them, they will chain them, they will not give them food, they will keep them in a place so that they believe that it is the demon they are punishing. They are trying to take out the demon in them, and and it's really, really depressing, for someone to be undergoing a lot of, hardship like that, and the person is having mental health problem, doesn't know what he or she is doing, and they're adding more to that person's problem. So I would say that back in the days, the church contributes, to the stigma of mental health problem.
My name is Olusegun Daranejo. I am a youth leader in the church. I am a medical doctor. I work in the emergency department, and I'm a Nigerian. It's common to the hard age that says black people don't see their psychiatrists, they see their pastors. Most people with mental health in an African or Afro-Caribbean church will see their pastor, their leader, house fellowship leader, youth leader, or women's leader first before going to see a psychiatrist or an expert or a counselor. So the church plays a very, very important role. Some churches believe as Christians we don't have mental health challenges. Some churches believe as a Christian you cannot be depressed, you cannot be sad, you cannot have a full-blown mental health crisis and breakdown. And so most times they don't talk about it. In some cases, some churches believe it's spiritual. And so they do talk about it, but they talk about it in a spiritual context, like maybe a possession and oppression, especially when it comes into issues like schizophrenia. So perhaps that makes it difficult for someone who think he or she might be experiencing mental health challenges to come forward and say, oh, I do have these issues, I do have these problems. It might be because they've heard so much about it being associated with a spiritual problem, and then they try to hide away from expressing or opening up to people.
I definitely feel like the church shy away from preaching about mental health. I think, again, because of context, black people, when it comes to depression and things, it's like you're weak. Unfortunately, I feel like we're breaking out of that now. But the whole African, some of us are first generation Brits, where our parents came here from Africa. And so they're really breaking out of tradition, whereas we're learning in English school who, what, when, where, why. We're asking them questions now, and they're like, you're disrespectful because of the whole culture. And I feel like that's why a lot of churches don't speak about mental health. It's just a traditional thing. Do I think it's important? Absolutely. Do I think it's a necessity? Absolutely. I think just looking at who Christ was, the Bible is clear. It says, let this mind be in you, which is in Christ Jesus. It will also say, love the Lord your God with all your mind. So there's clearly an element of our mental awareness that we need in order to love God. So to shy away from your mental capacity when it comes to Christianity, I think is a disservice to people. And so I don't understand why we don't do it, but it is so necessary for us to conform to the image of Christ. We need the mind of Christ as well.
When my mental health started to decline, so did my relationship with God, and so did my faith. For the simple fact that the more I wanted to be alone, isolated, by myself, the more I just did not know how to reach out to God for help, how to pray, how to even enjoy just fellowship with other church people, because I couldn't relate with them. If I can't relate with God's people, how on earth do I relate with God?
What I thought my depression was that I wasn't spiritual enough. I felt like I wasn't praying enough. I felt like I had sinned. I felt like I had sinned. So I felt like I was not in good terms with God. So this is what I had, because that was the only solution I could come up with. And so when I tried to pray, I couldn't pray, because that's the feeling that I had that time. It was like a block. It was like a barricade. I couldn't pass over to the other side to actually be in that mood or the place to pray or to communicate with God, if that makes sense. So I felt like that's why I kept thinking it was me who caused my own depression, because I thought I did something wrong, and I was trying so hard to find what I did wrong, but there was nothing. So I was thinking maybe it's something that I could not see. And so I was just like, well, God, look, I can't see what's going on, but, just take control. And that's it. That's all I can say.
When I got ill, I'd just been baptized. I was very active in the church. I was actually going out preaching. I was actually doing concerts for youth concerts. I was in church, going to Bible studies every Wednesday. I was dedicated to my church, and I still got ill. So I don't believe it's only a backslider. But that seemed to be the message that was portrayed. There was always looking for an excuse rather than acknowledging the fact that actually I was depressed because of my early life trauma, because of what others wasn't failed to realise. It was more of, it's influential, it's outside life that must have contributed to the fact that I was ill. It was a backslider's life. It was drink, it was drugs, it was my friends, rather than actually it's something that it was an emotion that I was feeling that had caused me to be ill.
Within the church, we think mental health is a demon. If someone says, oh, I've got depression or anxiety or bipolar or anything related to mental health, immediately within the Pentecostal realms, we want to cast it and bind it as a demon.
My mum and dad's reaction, my family's reaction, were quite different. My mum, being white British, was more familiar with the terms of mental health and what it means to suffer from mental health. And my mum was straight away, we need to get a doctor, she needs help. Whereas my dad, being black Jamaican, it was, oh, somebody's put juju on you, we need to get the priest here, we need a blessing. My dad was not willing to accept that I was suffering from mental health, and that was his attitude. And when my mum said that she was going to call the doctor, my dad was dismissive, and he was like, no, she's my daughter, I can take care of her myself. And he wanted to do it within the home. Even to this day, my dad will not accept the fact that I suffered from mental health. I cannot tell my dad that, Dad, I have depression or I need to see someone. It's more of, you need to go to church. And although I'm very spiritual and I believe in God and I have a relationship with God, it doesn't mean that you need to be dismissive. And I believe amongst black communities, we are too dismissive of professional help. Everything wants to be done within the family, but sometimes we have to accept that we need external forces, and that can be God's way of helping.
I've been in places where people are like, depression is a demon, let's pray against it. Or anxiety is a demon, let's pray against it. And incidentally, like a few days after I'd met my GP, someone went on a Facebook Live and they were talking about mental health and how it's people that have allowed demons to enter them and the devil to work through them. And it really ticked me off because I was thinking, maybe we really need to understand what's going on. And for me, it brought me to a place where there was a time when I thought maybe I wasn't prayerful enough, or maybe I hadn't read my Bible enough. Maybe I hadn't trusted God fully. That's why I'm having this condition. Hi, my name is Privmdada Obrike, and I am the Associate Pastor here at House of Prayer Ministries in Leeds. I am a wife to my husband, Efe. I am the founder of Identity Movement, which is an organization that helps young people to discover their identity and to walk in their purpose. My experience with mental health has been an interesting one, considering what I do for a living. In 2018, I had a miscarriage and I was so ill physically for a long time. And when I healed from that miscarriage, I realized that I hadn't dealt with my emotions. So as a result, I was diagnosed with mild depression, clinical depression. And that almost took me out because I couldn't understand how I was doing okay. I was happy, I was smiling, but at the bottom there was something missing because I hadn't dealt with those emotions. So I found myself sleeping a lot. I found myself on the verge of suicide. I even had one day over the summer in 2019 where I felt that I needed to end my life. I couldn't cope with it anymore. And I started contemplating if using a knife was the best way possible or just jumping into the motorway, because where I live, I'm just near the motorway and there's a bridge that we go across as pedestrians. And I literally saw myself just jumping off of that bridge and trying to get help because I couldn't cope with the pain that I was going through. I couldn't cope with all the emotions that I was feeling of having lost a baby. I felt like I had failed my husband. I felt like I had failed myself. I felt like my body had given up on me. And I felt so responsible because I thought I could have done, maybe there's something that I could have done that would make sure I didn't lose my baby. But now I know that there was nothing that I could have done because I did the best that I could do with what I had.
A wise man once said, as time goes on, people start to leave, people start to go. And I actually experienced that throughout my academic journey. Close people that I thought I would grow up with, people I thought I'd see when I'm done with my academic journey, but quite a few of them, even a small number of them, have left. My name is Oluwadamilola Agbabiaka, and I am 27 years of age. I am a research student and I am from Nigeria. My experience with mental health is a very specific, broad situation affecting different people. For me, I have been battling with grievance, losing loved ones that I will never see again. I have realized how you pass away makes a massive impact on those you leave behind. Sometimes it's hard. I had a friend, he was pushed off a building in another country and he died on Valentine's Day. It was weird. It felt like a movie. I didn't know how to react. Family tried to get justice, but they weren't given the opportunity to. And mentally, it made me realize, what is going on? How safe are we really? After pondering on that, I started losing more family members. Be it age, be it cancer, be it unexpected situations, and I felt overwhelmed because I couldn't fully mourn these people because I was on my academic journey. And I've been saying a quote, I'm just surviving, and I believe we are all surviving.
I was probably in this state for a long time, but I was in denial. It wasn't until I walked into the doctor's office in May of 2019, but we were just having a normal chat, and she was like, oh, I've got this piece of paper here, and it was things like, oh, have you ever thought of killing yourself? And I was like, no, never. She was like, oh, do you feel sad sometimes? Yes, I do. Do you feel very overwhelmed? I'm overwhelmed every day. Do you feel like you don't want to get out of bed? I mean, who doesn't? Those are sort of the responses that I was giving because I just thought that was normal. But by the time we'd finished it, because they grade you up to, I think, about 30 or 50, I can't remember what it was. But my score was like a 29 out of the number that they needed. So she basically said to me, based on the answers that you've given me on, can you get up in the morning? Do you feel happy with your life? There were a lot of questions and I got a 29 out of it. And she said, we need to put you on medication. I'm like, sis, I came in here just for a normal checkup. I didn't come in here, to be told I've got depression and I need to get on medication. When she said to me, oh, you've got mild clinical depression and we need to put you on tablets, I was like, no way. Listen. Over this weekend, I just got ordained. Let me show you pictures because I had some bomb pictures. But it's when they ask you these questions and you start thinking to yourself, actually, hang on, I couldn't get out of bed yesterday. Oh, I didn't feel like showering the day before. Oh, I'm not picking up my calls. I'm only picking up my calls if the husband calls or if my mom calls. Oh, when people call me, I'm putting up a voice. But, you know, I could be laid in bed and my parents ring me and I'll be like, hey, how are you doing? I'm fine. And stuff like that. But I'm not fine. I'm in bed. I can't get out. I haven't got the strength. I don't see why I should get up at all. I don't have any reason to get up. So it really makes you think that sometimes we mask it, but deep down there it's there.
I realized I needed help when I saw the situation I was in. It was very personal. Every year I had someone to mourn, and I couldn't fully mourn them. Some years I lost multiple people, and I wasn't just ready for the barrage of losses. It was overwhelming. So I was recommended onto the university's counseling support, and made me realize that it's a life journey. The grieving stops when you go, and you are the last lingering memory, or you have those lingering memories of those who are gone, so they live on within you. You are a living legacy because you had a relationship with them. Relationships are what we live for. Build them, mature them, grow them, sow, reap. Yeah, so I'll be more positive. We live in a very, I'll say, harsh world, and we have to keep ourselves positive. We have to lift ourselves up. The world isn't going to do it for us.
When we come into a country where you don't know anyone, the one thing that unites us, regardless of race, culture, tradition, will be religion. So for me, it's Christianity. It's being in church. So it becomes the first place of community that I should be able to run to. So it's very important, because those links will be able to help you. If you don't have parents here, you can get parents from church. If you don't have any friends, you can get friends from church, because we all have a common ground, which is we believe in Jesus, which is we believe in the Word of God, which is we believe in the power and the healing of Jesus Christ.
It's very important that the church gets this right. There's a place for medication, there's a place for antidepressants, there's a place for drugs, but there's a more useful place for talking. Pastors, barbers use some of the techniques used in mental health to help people with mental health problems. So if you went to your barber, or you come to speak to a youth leader or to your pastor, and you tell them your problems, that point of expressing, relieving yourself of the problem is one step towards recovery. When you talk, the person expressing himself is talking out the problem, and the person talking back, a well-trained pastor or youth leader, can help navigate the problem, identify the cause of the depression or the problem, and provide solutions to it. And that is an important way I say the church can help in resolving mental health problems. And so, as a pastor or as a youth leader, when someone comes to me with mental health issues, apart from praying with them and encouraging them, if necessary, it is important to signpost, lead, or refer them to the professionals to help them.
We have to remember that we are all God's children, and although we can be healed a lot, and I believe we can be healed a lot through prayer, but we also have to accept that we need sometimes the intervention of another professional.
It's really easy to tell somebody when they're feeling down, just go pray. Here's a scripture, which, you know, is very true. But also I think you need more than that. the way that people heal, the way that people get through things, a lot of times is, I think anyway, is talking through things, having somebody that just understands them, empathizing with somebody, saying, okay, like, tell me more. What do you mean by that? How do you think you feel from that? Like, how did that make you feel now? Like, do you think that was right? Do you think you should have been treated like that? I mean, those are the questions that my therapists were asking me. And it felt like she had a real investment in me and my well-being. That she was rooting for me. And I think for me, I think if I saw pastors and leaders, I think they do really care about their congregation. I think that is there, but I think sometimes they struggle to know how to show it. And I think if there was a real feeling of like, you know, tell me how you're really feeling, like, let's sit down, I'm not judging you, I just want to hear more. I think that maybe there would be more space for people to open up to people in the church.
I got ill in 2009, so we're talking 11 years ago, and I think a lot has happened since then. It's more in the open than it was back then. However, when I became ill, not one person from my congregation came to visit me while I was in the hospital. Although they sent their love and their wishes and their prayers, they was not actively reaching to me. I think as a church, the support needs to come to the person.
I think as a psychiatrist, it's often difficult for people speaking to me about mental health conditions because they may feel a sense of judgment. I'm talking about Christians in particular. And there's an idea within society, and I think particularly within the church, that seeing a psychiatrist is the last resort. And I think within the church, people may go through a number of different alternative angles before seeking medical treatment. And so one of the things we really try to encourage people in is that there's nothing wrong with seeing a psychiatrist. Taking medication, for example, antidepressant medication, can sit alongside talking therapy and can sit alongside a range of support that may be happening from a spiritual perspective. So the key point there is that those things don't need to be in conflict.
A research was done that showed that general quality of life among those who had a religious belief that they held on to was a lot better than those who didn't have any religious belief. So having a religious belief, it's a plus usually for the mental health. It usually helps. So being able to marry the both of them together, I would believe would give better output. It will yield more productivity at the end of the day if you're able to marry the both of them together. And that's where the place of a Christian therapist comes into play. A Christian therapist is a therapist that has been allowed to bring his Christian views into the professional workplace. So before you come, you know that he's also using Christianity as a tool to seek to make you better.
So the Mind and Soul Foundation is a charity which aims to support churches in exploring issues of mental health and being fully equipped in supporting members of those churches in dealing with mental health challenges. The directors are consultant psychiatrists and pastors, all with an interest in mental health conditions and how we can demystify some of the myths that abound within the church about how to tackle mental health challenges. I just try and contribute to the charity in a number of ways, depending on the need. One of the things that I get a lot of joy from is being able to work in a slightly different way. In my clinical practice, I'm seeing people on a one-to-one basis. With the charity, it's more about taking more of a role within the public, and that can be doing videos and interviews like this, which just help to touch briefly on a few topics and give people encouragement if they may need to seek help. It can be doing webinars, other forms of teaching. We have an annual conference in which we bring church and mental health leaders together to see how we can tackle these issues together. and also just contributing to modules that are taking place within churches who are looking to really put together some courses around mental health conditions also.
A good example of acceptance of mental health or physical health issues is that we have chaplaincy in hospitals, in most hospitals, and that shows you that even the secular world acknowledges the need for the spirituality. So whilst you're in hospital, you're having your physical health attended to, you still have access to, a priest or a pastor within the church. And so I think the same needs to be applied to the church, where they allow, an integration of having workshops around mental health. So thinking about holding workshops to address mental health issues, workshops to educate people on mental health, and as a community, as a Christian community, talking about experiences that can impact or improve mental health is a good way as well. So I am part of a group of therapists who offer services to the faith community and non-faith community, known as the Christian Psychological Services London. And so we set up our organization as a way to allow people who want to access therapists who are of a Christian background. Sometimes people feel that they need somebody who perhaps they have a sense might understand their faith. So we set that up to get together just to meet that need. And we are part of a larger network of psychologists known as BAKIP. And BAKIP is the British Association of Christians in Psychology, which comprises of clinicians and academics. And our work primarily is around looking at integrating of psychology in the secular world, and looking at integration of psychology and Christianity in our practices as well.
The first time that I was able to speak about it, whether that is my experience when I was 8 or just my mental health at that time, was when I got to uni. And in the church we had this mentorship system where we were assigned to sort of a big sister, big brother that would sort of help you in any way, shape or form as you were sort of adjusting to uni life. And I remember that the lady that was my mentor at the time, she sat me down in Costa and she said, all right, well, we're going to start this mentorship thing and just tell me a bit about you. And I remember that day, out of nowhere, I literally told her every single thing about me from when I was 8 years old, my struggles through school, and to the point that I was there at 18 years old. And it felt very liberating to be able to speak about it. I don't know what provoked me to speak about it, but I just felt safe enough to speak to her about it. And around that time, I also spoke to Sam, and that was just because he was a good friend, and I felt safe enough to speak about it without being judged. Again, I just feel like being in that new space when I went to uni, it just felt a lot easier to speak to somebody that doesn't know me, doesn't know my backstory, doesn't quite know my family or where I come from. I think being able to verbalize it was the beginning of that healing process, really. I feel like I wasn't able to deal with it until I was able to acknowledge it myself and to speak about it and to share it. And I feel like every time I told the story, I was able to kind of reconcile just all my thoughts, my understanding of the situation, and just work on my own confidence and healing and growing and moving forward from it. Because you have to look back and look at the past and examine your past in order to move forward effectively, really. And so I felt like it was a healing process for me just by being able to speak about it. It was therapy in itself to be able to talk about it.
There were little things that had kind of made me put in my head that therapy might be a good answer. It sounds really silly, but like I listen to a lot of podcasts. And there's a podcast that I absolutely love called The Read. And it's these, they're from America, these like two best friends, and they talk a lot about their own mental health. And it was the first time that I'd heard somebody that was like me talk about mental health. Somebody that obviously not sounded like me, they're American, but you know, they were Black, they had a very similar experience, and they were talking about therapy in such a candid and open way. They were like, oh yeah, I went to my therapist last week, talked about my family traumas, and I was like, people do these things? Like, this is a thing that people like actively talk about? Like, people aren't suppressing their feelings every day? What? And it sounds silly, but I think just having those little snippets here and there of hearing about therapy, kind of being like, okay, people are doing this. It's not some weird, crazy concept. It's not as if like, you know, I think people sometimes think of therapy, you have to be like severe mental health, like it's psychosis, it's, you know, like very extreme levels of it, or maybe being like diagnosed with a certain mental health condition. And I wasn't there like that. I didn't see myself like that. But yeah, I was hearing about people who had very similar experiences to me, that had talking about traumas that had happened to them and about how therapy really helped them. So I think that's kind of how I got to the conclusion that maybe therapy was something that I wanted to at least explore. Like, I didn't know what it was going to look like, but I thought, let me just try. Like, I'm either going to find it really useful or I'm not.
This person, actually, it's funny because they explained to me that I've been through, the words they told me was that I've been through that too. So when they said I've been through that too, I was like, what? You've been through the same thing I'm going through right now, and you've come out of this and you're happy? I was like, okay, so it's not just me then. That's when everything else that I thought before about, oh, I'm dampening somebody's joy, nobody else can understand me. That's when all of that was cast aside, and I was like, so this is the thing that people actually experience, and they come out of it and they're okay. Yeah, that's what was different about that person, was that they were able to tell me that I will come out of it, and with so much confidence because they've experienced it.
That day I realized I needed help. So when I woke up in the morning, I rang the Samaritans, and the gentleman spoke to me for a little while, and he told me to ring my GP because there would be help available. So I rang my GP, and they did a Skype call afterwards just to see how I was doing, because I didn't know what else to do at that point. When the husband came home, I was like, listen, dude, I've got depression. And then one of my tutors from uni, she'd been really lovely. And she just used to text me and email me or whatever. And she found me on a really bad day. So she rang me and we had a WhatsApp video call, and I just cried. And she was just like, I understand. And she just started talking to me, and she, explained her own experiences. So that was really helpful to have that. And then a few weeks later, I did manage to tell my mom how I was feeling, what was happening, what was going on. And she was really supportive. And we would speak, and then she would just touch base with me every week. Hey, what's going on? What can I do to help? Do you need any help and stuff like that? And my tutor, Dr. Patricia, she would also just touch base with me. Hey, Priv, what's occurring? If you need to talk at any point, let me know. And, we just had code words is it cloudy today? Is it sunny? So if I said, oh, it's really cloudy today, then they would know that, okay, an episode might be coming. If it's sunny, it is sunny. So for my mom to accept me as I was a really big thing. For me to be able to say, Mom, I'm struggling, and her look back at me and say, I'm gonna walk this journey with you. I think I found confidence to even dig myself out of the hole that I was in now, because she understood. She didn't sit there and say, oh, it's demons or anything, even though she's a pastor herself. But she just looked at me like I'm a human being. And she supported me, said, what do you want me to do? How can I make life better for you? My husband would just started taking me out for walks every day when he comes back from home, because he knew that if he didn't, I'll be stuck in the house until the next time we go to church on a Sunday. If we don't go to church on a Sunday, then I'm never going to go out. And I'm like, I'm the one person that's in church every Sunday. But when this had a hold on me, I couldn't even get up for church.
I first sought out help It's actually been quite recent. At first, I thought that I was completely okay, and that my traumas weren't actually there. It was only until I enrolled in a counselling course that I realised how much I was actually carrying, how much pain I was carrying, how much I was hiding as well. So I didn't seek out help because I felt like I needed help. I almost ran into it without knowing it. But it was the best decision that I ever made. Reasons being, I feel like I've become more intimate with myself. I'm now very aware of myself, my body language. I'm aware when I'm not expressing or suppressing my pain. I know what that feels like in my body. So I didn't seek professional help because I thought I needed it. And that's number one. I think that the whole world needs counselling personally. And I feel like a lot of people need counselling because of people who don't go to counselling, if that makes sense. You know, a lot of us we go counselling because of people. That's let's just be honest here. And so I feel like the whole world needs counselling. So I didn't go to counselling because I felt like, oh, I need to get through this problem. I need to get through this. I need to get through that. I just ran into it and I found that was the one thing that I needed. It's a love-hate thing. It really digs into you, but it's like, if I'm going to say it in the most philosophical terms, it's like where there's death, there's life. And once you come to the end of yourself, that's when you find like a new beginning. It's absolutely incredible. It's amazing. So that's why I sought out professional help.
I got in touch with a Christian counsellor that was recommended by a friend of mine who also went through a series of counselling, and she gave me a really good recommendation, and I decided to reach out. It was actually my husband that told me that I need to get help.
Hi, my name's Sam Ikpe. I'm a mechanical engineer. I'm from Ghana, and this is my wife, Chedza Ikpe. So the reason I asked Chedza to seek professional help was because I think we got to the point where a lot of times, just through discussions and sometimes, arguments, she would, from my perspective, I could see her getting wound up by some of the issues that she had dealt with. And, being a man, being logical in all our answers, I'd try and sort of give her logical answers to solve the issue. But then it seemed to always have a backlash or a negative effect. So I think eventually I realised that I wasn't the person to sort of help her out in that regard, and professional help would be better because at the end of the day, that's what they're trained to do, so...
Like a neutral person.
Yeah, neutral person, objective, And it always turns out that, a lot of times I'll advise her to do something. She won't listen. Someone else will tell her to do the exact same thing, and she'll listen. So,
I feel comfortable talking with my family about my emotions, which I feel they could probably help me with. A counselor is different, I would say, because that is a professional. So I appreciate what's done with the professional. From my last experience, I realized they are there for you. They're here to listen to what you have to say, and they have trained to listen and help you understand where those feelings you are feeling are coming from. And yeah, it was more, let's say, helpful, more eye-opening, more insightful. The learning experience, my mood changed over the 12-week program, and yeah, I felt more uplifted, more open, more satisfied with life. Not so paranoid, not so worried. Understanding, accepting.
So I didn't feel any type of sort of inadequacy because I wasn't the one to give her advice, because I realised at the end of the day, the best advice I could give her was to go and get help. Do you know what I mean? Don't get me wrong. When she came back from the first sort of therapy session and she told me about it, my first reaction was literally, you can pay me that £45 and I'll tell you everything she said. But again, because it's me, it might not come across well. And sometimes I've realised myself when I'm talking to her, I have my own way of talking to her, expecting her to understand, whereas sometimes she doesn't need the way I will necessarily communicate to her. She needs somebody else to communicate to her that way. And I'm not a trained profession, you know what I mean? But
I would say there are a lot of organizations out there with regards to mental health. You also have organizations such as Mind that, are charities. So there are charities that can help. But I think in general, people should be able to access NHS mental health services by presenting themselves, there are emergency services that, out of hours numbers that one can ring. So generally mental health services tends to respond swiftly. But however, I think, continuing to actually insist with your GP is, the way forward. But there are other charities which you can ring. The NHS has a service which is called talking therapies, and talking therapies is relatively accessible, and you don't actually have to wait for a GP referral. You can contact them directly, and you will be guaranteed to get an assessment within a reasonable amount of time. So you can actually bypass your GP for a referral to some of the NHS mental health services. So, historically, people of Afro-Caribbean origin have tended to perhaps have more support within their communities, and also perhaps, as you've highlighted earlier, experience within mental health services perhaps have left them with a feeling that, they're either, labeled or they're not heard or listened to. I can safely say that the National Health Service is working towards, cultural competencies. So, being able to actually look at, cultural issues when people are presenting. So what I would say is that with the population of Afro-Caribbean, people of African origin, or as you might say, Black people, is the need to be able to, communicate their difficulties is one area. So, and not to assume that you will not be heard, because I think that's the other barrier to accessing therapies and accessing mental health services. And also within the communities, acknowledging that mental illness exists. It's okay not to feel okay, and then, access services. People take care of their bodies. You eat at least on an average 3 to 4 times a day. People take care of their spiritual aspects of their being. If they're people of faith, they spend time going to synagogues, mosques and churches at least once or twice. For some people, almost every day. But matters of your mental health is what we would call the matters of the soul, and they should also be attended to. So you don't have to wait until you have a problem to actually look at your mental health. Addressing your mental health, maybe just actually looking at day-to-day things like, your sleep, activities that just keep your mind healthy as well. So avoiding a lot of negative influences, negative television documentaries or things that may make you feel unwell mentally. So it's just really looking at healthy options with regards to your mental health.
And I think there's other tools that I do that are definitely free. I think the big one for me is actually journaling. I'm a huge journaler, which is definitely a tool that I've learned from therapy. So I literally will write like pages and pages of just how I'm feeling, just everything that's going on in my life, try and make sense of it. So that's kind of more of the hard work, because that's one thing I think therapy is hard work. And then I think in terms of things which is like a key thing in therapy, is the idea of self-soothing. So being able to, essentially when you're feeling low, what are your things that allow you to feel better? And I think that's where like my art and my music come in, and all the kind of creative aspects that I enjoy taking part in, is that it's almost like a self-soothing. It's like, I'm feeling a bit meh, let me just draw for a bit, let me just get out of my own head for a second and just do something that I love, that I'm passionate about. I'm not doing it to any standard. I'm not doing it for anybody. I'm just doing it for the joy of it, the love of it that it gives me. So yeah, I guess I use them kind of indirectly as a way.
My husband taught me to learn to ride a bike, and I was falling all the time, and I found that really funny. I mean, we get therapy in different ways, but for me, learning to ride the bike at my old age was quite interesting because I was on the floor all the time. I started, bullet journal. So that's where I write woke up, tick, had a shower, tick, had breakfast, tick, and stuff like that. So when the clouds were starting to come, I'll be like, but hey, I've had 7 good days in a row and there were no clouds. So if these clouds come, we know what to do. And I started writing in this journal thing that every day it asks you in the morning what you're grateful for, and then it asks you what do you want to achieve today? What would make your day a really good day? And then at the end of the day, it asks what 3 things made your day. So I was just feeling that in every day. And then I realized, I'm actually grateful for a lot of things. So if I had a somewhat bad day, I'll just go back to those days where I've had good days and just be like, yesterday was fun because I did that. Maybe I need to do that a little bit more because I enjoy it better.
When I listen to music or I feel my atmosphere with something that maybe is external to me, it helps me to just understand that there is still goodness out there. There is still positivity, there is still joy, and there is still happiness, and this is a passing cloud. And those 2 things really help me. So music and painting especially. Honestly, I don't know where I would have been if I couldn't express my feelings on paper or on the piece for other people to just see. It helps, Sometimes there's things you can't speak out because you don't even know the words to express it. But when you paint it and you put it down, it's like you're taking it all out from you and then just leaving it on a paper and it's there. You don't have to, it's not bottled up inside. So that's why I'm happy that I'm able to just paint and express it that way.
I started to find healing in even worship, just singing, writing songs, music. There was therapy in it, and in the lyrics I'd be somewhat communicating how I was feeling and the journey that I'd been on without being explicit about what exactly I was talking about. I remember my mentor, every time I wrote a song and she'd read the lyrics, she knew exactly what I was talking about, and she could tell the emotions that were sort of invested in these lyrics. And so I feel like being able to talk about it, being able to go back and invest in this relationship with God and pick up these therapeutic hobbies really, really helped me to communicate myself and to continue resolve sort of the conflict that was going on inside.
Play instruments. I attempt to plant, but the UK weather is very difficult there. I like washing dishes. It's therapeutic. Just the cleanliness, just washing all the dirt, scrubbing it away. I cook a lot. I stress cook at night. So wake up in the night, cook, freeze it. It's good. I do calisthenics. I work out. I do yoga. I am trying to inspire myself. I have been praying, I have been meditating, I have been thinking of my future, I've been investing, I've been failing, I have been succeeding. I've been thinking about myself, thinking about where I want to go. I have been more aware of life, aware that it's mixed with blessings and curses, or you could just say blessings, double-edged blessings. Accept the good and the bads because they all have stories and lessons to teach. I am still inspired and aspiring to be a comedian just to make people laugh, and hopefully my mom will be proud of that.
I just wanted to tell you that you are amazing. I wanted to tell you that you are loved. I wanted to tell you that you are the world's greatest, no matter how you feel today. But you are the world's greatest to someone. I wanted to tell you that you're created for a purpose and you will serve your purpose, whatever that purpose is. I want to tell you that mental health, depression, anxiety, bipolar, whatever form of depression you have will not stop you from achieving your goals, will not stop you from being the person that God made you to be.
If I'm supposed to be a strong woman, the only way I can be a strong woman is by facing and challenging the things that don't make me comfortable or don't make me feel uncomfortable. And if I challenge that and I overcome that, I get stronger and I don't stay at that level.